Months after testing positive for COVID-19, Nancy Rose continued to feel unwell.
The hardest part for me was the brain fog, the fatigue, and that different parts of my body just ached.
These are common symptoms of so-called long COVID that can last for months or years after an initial infection.
Getting winded.
Studies indicate up to 30% of Americans infected with the coronavirus end up with long COVID. The worry is that with the highly contagious Omicron, the number of long haulers will explode. Little is known about how best to treat long COVID. Researchers are scrambling to find answers. With $1 billion in funding from Congress, the National Institutes of Health is now researching the condition. Clinics specializing in it are also popping up around the world.
If we don't learn something very quickly, it's going to get harder and harder to make a difference for these people.
Many long haulers find it hard to work or take care of themselves.
If I'm going to get anything done, I have to get it done in the morning. That's my best time. And if I'm come by about 2 o'clock, I'm getting tired.
The CDC, U.S. Department of Health and Human Services, and the Department of Justice have all determined that long COVID is a disability. But experts say accessing disability benefits is exceedingly difficult, especially for those who got sick early in the pandemic.
They don't have an actual positive test because they got this disease before they had the test in the mainstream. So they may not be able to get disability benefits because there is no proof that they had it.
Tannenbaum says getting a doctor's note acknowledging the condition can also be challenging. Long COVID may be mysterious now, but some experts say healthcare systems should prepare for what could be a wave of long haulers that could have a dramatic impact on economies around the world. Karina, CGTN.